Good evening, and thank you for joining us today for this first in our series of our Wednesday Wellness Webinar Series, the Epilepsy Foundation of Minnesota. I want to thank you for joining us and let you know that this is the first of 8 in our webinar series. And these webinars are all based on elements of wellness. So tonight we're talking about sleep, but some of our other topics include things like diet and exercise, mental health, things like social relationships, and many other topics that we have coming up. We're so glad you've joined us. My name is Amy Haugen, and I'm the Senior Regional Manager at the Epilepsy Foundation of Minnesota. Tonight, we're going to go through a few slides in the beginning before I turn it over to our guest speaker. Just a couple of housekeeping things for you. This will be done at 7:30. It's a 75-minute webinar. And please remember that if you are having trouble with connections or the PowerPoint and webinar coming through clearly, it's a good idea to shut off any apps or windows you have in the background, in particular ones that take up a lot of bandwidth, like music or video apps. You will all, following this webinar in the next few days, receive a follow-up email that will include a certificate of attendance, just stating that you were a part of this webinar, you attended it, in case you need that for your records. We are recording this webinar, and the recording will be available on our website. And in that follow-up email, you will have a link to where you can look for that recording. Just want to give you a little bit of a disclaimer. We are hosting this webinar, and all of the information we shared is meant to inform attendees of all of the aspects of sleep and epilepsy. And all medical questions should be directed to your medical provider. One thing to note, you might see on your screen that you only have one button at the bottom, and that says Q&A. That is intentionally, so throughout the webinar, there will be opportunities for you to ask questions at any time using that Q&A function. So if you click on the box that you see Q&A on, it'll pop up to the right typically, and you can type a question in at any point. We will not pause in the webinar for questions until the end, but we will allow for ample opportunities to get those questions answered at the very end of our webinar. I wanted to take a minute to just share with you a little bit about epilepsy and the prevalence of epilepsy and what epilepsy and what a seizure are. So one of the things that we know as far as prevalence is there's over 50 million people in the world who are living with epilepsy. If we think about it in the terms of the United States population, about 1 in 26 people will develop epilepsy at some point in their lifetime. Another way to look at it is that 1.2 of the United States population at any given point is living with what we call active epilepsy. And that can be defined as having been treated within the last year or having had a seizure within the last 12 months. And of that population, nearly 500,000 are children, and then nearly 1 million are over the age of 55. So that gives you a little bit of background on how common epilepsy is. Epilepsy is a neurological condition, and 2 key words when we think about the word epilepsy is unprovoked and reoccurrent. It's a neurological condition diagnosed many times by a family practice, nurse practitioner, or a neurologist, or even an epileptologist. But because we know seizures are common in the general population, you have to have a reoccurrence typically before a diagnosis is given. And the unprovoked nature means that it isn't brought on by something else happening within a body system. So a great example of that is a febrile seizure that oftentimes can come with young children when they spike high temps, or someone who has another health condition like diabetes, where they have a seizure that is related to their blood sugar. Those would be considered provoked. In the epilepsy world, unprovoked is what the physicians are looking for, and the reoccurrence. Also called the seizure disorder, sometimes called a seizure condition. A seizure itself is a finite event that occurs at a given point in time. It has a start and a stop, and it's a sudden uncontrolled electrical activity in the brain. And so oftentimes when we talk about seizures, it's good to remember that there's a start to it and then there's an ending point to it. And so it's unusual behavior that occurs during that time of increased electrical activity. It can occur with other conditions. We term that as co-occurring or comorbid conditions. And it looks a lot of different ways depending on how much and what parts of the brain are actually involved. There are over 40 different types of seizures. Tonight, like I mentioned, we are talking about sleep and epilepsy, and I'm so excited to introduce our guest speaker, Denise Leety. She's an advanced practice registered nurse and a certified nurse practitioner at Gillette Children's Hospital, and she's been there serving the pediatric population for over 16 years as a nurse practitioner. Her background is in neurology and sleep. And prior to Gillette, she has worked with the pediatric population as a registered nurse in a variety of settings. I'm so excited to have Denise join us and to share her knowledge with us. Just a reminder that Q&A is available to you to type in at any point, but we will answer those questions at the end of the presentation. Welcome, Denise, and thank you for joining us.
Oh, thank you, Amy. I'm really excited to be here tonight, and I do appreciate the invite into your wellness webinar here. So, again, as Amy mentioned, I am going to be talking about mostly sleep health and how it pertains to epilepsy and seizure disorders. So our objectives today is, first of all, just to define what is sleep health, and also to look at some common sleep disorders, and just look at how sleep impacts a person who has epilepsy or seizures, and also to talk about having healthy sleep habits, and also just to gain some tools and other resources to help improve or to maintain a healthy sleep practice. Next slide. First of all, quality sleep is very important. We know that 1/3 of adults report that they do not get the recommended amount of sleep. Often they get a lot less than what is recommended. Quality sleep is very essential for just overall good health. It's very important for our brain functioning. It's important for our heart functioning, our lungs. It helps with our metabolism, our immune function. It can help our mood and also our resistance to diseases. Lack of sleep can be linked with many chronic conditions like type 2 diabetes, heart disease, obesity, depression. Also, it is a factor in motor vehicle crashes or accidents and can contribute to injury and ongoing disabilities. So really getting enough sleep is a necessity, not really a luxury. And I know many of us would probably like to function on less sleep because if you're like me, there's so many things I want to accomplish within a day, but really sleep is a necessity and good for our overall health. Next slide. So there are 4 sleep stages that we all transition through when we go through a night of sleep. So stage 1 is a non-REM sleep. REM means rapid eye movement sleep. So initially, as you're going into sleep, you go from your state of wakefulness into sleep. So with this first stage, sometimes you don't even know that you're starting to fall asleep because you can wake pretty easily. Your heart rate and your breathing start to slow down a little bit. In stage 2, another non-REM sleep stage, the sleep becomes a little deeper and your heart rate and your breathing start to slow a little bit more. Your body muscles start to relax a little bit. Your temperature may start to drop a little, and the brainwave activities start to slow down. In stage 3, non-REM, you are now entering a deeper sleep, which is needed or necessary to feel refreshed in the morning. In this stage, it is difficult to awaken somebody. This stage is very important because it helps to repair your muscles, it improves immune function, and also in younger children, toddlers, it also is important to enhance their growth and development. So the REM sleep is when you can actually see this on somebody that the eyes move kind of rapidly behind closed eyelids. Your breathing becomes a little faster and irregular, and your heart rate and blood pressure start to increase a little bit and they become to where they would be if you were actually awake. In this stage, people often are dreaming. This stage is also very important or critical to enhance your learning capabilities. It helps to improve memory, helps to improve your concentration, and just good for overall mood. We tend to cycle through all four stages several times throughout the night. And depending on the age of somebody, you can be in each state for different lengths of time. So, for example, a newborn baby will spend more time in REM sleep than an adult would be. And as adults, though, we probably spend anywhere from 90 to 120 minutes, going through these different sleep stages, and we will go through through the four stages of sleep, maybe 3, 4, 5 times a night, depending on how long you sleep. Next slide. So sleep, again, is very essential for brain health. So during sleep, it helps to wash away the toxins that are building up in the brain. It helps the brain to reconnect, helps to regulate that mood. So we have better mood, better brain balance. It also is very important in helping us in our memory and learning. So it enhances our focusing ability, helps us to learn more efficiently. It helps to regulate our circadian rhythm, which is that internal clock that helps regulate our sleep and wake cycles. And just with our judgment, it helps to minimize taking risks, because if we're sleep deprived, we tend to take more risks than necessary. Next slide. So poor sleep can have a lot of negative impacts on us. So one way is weight gain. So our hormones can be affected as a result. So typically when we're sleep deprived, our brain thinks it is in a kind of a stressful situation. And when we are stressed out, it increases cortisol levels, which affects you have changes in your hormones, which then can lead to weight gain. We also are more tired, so we're less active. And we have a tendency to eat more higher fat, high carbohydrate foods. We kind of search for those comfort foods, which of course eating too much can lead to weight gain. There has been a relationship that has been found between the Alzheimer's related proteins and lack of sleep. So they do feel that lack of sleep over time can increase the risk of dementia. We know that it also decreases our immune response. So someone may become ill a lot more frequently, or you can delay your recovery from illness too. So it may take you longer to actually recover from any type of illness. We know that it increases the risk of cardiac disease. So there's a higher risk factors for developing atherosclerosis, more incidence of heart attacks or stroke. And it also can increase the risk for developing a type 2 diabetes. It can elevate your blood sugar. Next slide. So sleep deprivation affects our mental health. So we know that sleep deprivation can increase a person's incidence of depression and anxiety. It just slows down our thought processes, so people don't think as clearly. It can also impair our decision-making abilities, where we can't quite come up with the appropriate responses or appropriate decisions to things. It does make learning difficult. It can alter our mood, so we can become more irritable, more cranky. And for those people who are at risk, it can also increase suicidal thoughts. Next slide. So I wanted to talk, next slide. I was going to talk about some common sleep disorders that I see quite frequently. So insomnia is one of the most common sleep disorders. And this can entail having difficulty falling asleep, or even difficulty staying asleep or waking up too early. So for example, difficulty falling asleep with a person who has difficulty falling asleep, they may not be able to fall asleep for 2 or 3 hours after they actually go to bed. Sometimes people wake up in the middle of the night and be awake for 2, 3, couple hours before they fall asleep again. Or they may wake up in the early AM hours, like 3 in the morning, and not be able to fall back asleep. So insomnia can just occur in isolation, making it a primary insomnia, or it can be associated with an underlying medical condition like stress or anxiety. Really, insomnia can occur at any age, and about 1/3 of adults do experience some type of insomnia, whether it's like a primary insomnia or a result of an underlying medical condition. And even children are affected by insomnia. So 20 to 40% of children do have some type of insomnia. Next slide. So insomnia contributes to daytime fatigue. If you're not sleeping well at night, it makes it harder to wake up in the morning. So you're often really tired. And that tiredness just continues throughout the day. It can contribute to moodiness, irritability, the crankiness, just not having those mood changes. Can also contribute to depression. It can affect your energy level, where people just aren't motivated. They just are just tired, so they tend to move around a little slower. That in turn can affect productivity, especially at work. It can affect how you think cognitively, so you just don't think as clearly. You kind of feel like you're in a fog sometimes. People can become forgetful as a result of that. Because of that cognitive change and just being tired and not on top of your game, basically, it can also increase the incidence of accidents. Some people just start to become anxious about going to sleep because they know that they will have a hard time falling asleep or staying asleep, so they become more anxious, which then contributes to having more insomnia. And we know that insomnia creates sleep deprivation, which in turn increases your risk of cardiovascular events, compromises your immunity, leads to obesity, diabetes, and also increases the risk of seizures for people who have a seizure tendency. We know that insomnia can interfere with your ability to work and being productive. It impacts driving. We often hear of people who fall asleep behind the wheel, which, as we know, can contribute to accidents. It can impact social activities because if you're tired, you may not be able to attend something you'd like to do. And just we know overall quality of life tends to be lower due to the daytime sleepiness and insomnia. And of course, it can lead to serious health implications. Next slide. So when we treat insomnia, it's a modality of things too. The first thing that I like to do is look at the lifestyle of somebody. For example, I like to use teenagers because they always seem to do things a little differently than the rest of us. But teenagers like to stay up late at night, whether it be talking to their friends on the phone, playing video games, or watching movies or whatever it may be. Over time, staying up late like that to do something fun can impact the ability to fall asleep. We look at sleep hygiene. That includes routines, habits, and I'll get into that a little more in some later slides too. If there's an underlying health condition like anxiety or someone's under a lot of stress, it's really important to take care of that first or treat that first, because if you don't take care of that, it won't treat or won't help the insomnia. So very important to treat that underlying health condition. There are things like cognitive behavioral therapy, relaxation techniques that can be incorporated to help somebody with insomnia. And these just involve helping teach someone or train someone how to relax their mind, relax their body, change their thoughts in hopes that will help them fall asleep a little easier or go back to sleep if they wake up in the middle of the night. Sometimes medications are needed. There are prescriptive medications out there that it's not always first line, but if they're needed, there are some alternatives out there. But sometimes replacing a natural hormone that our body already makes, melatonin, can be the first step before you actually move to a prescriptive medication. Next slide. Another sleep disorder is sleep apnea. So sleep apnea, you have brief interruptions of breathing that occur while someone is sleeping. These can last 10 seconds or sometimes longer. They occur repeatedly throughout the night. What happens with sleep apnea is the muscles of the upper airway tend to relax and they kind of compress on each other, causing the airway to block, which limits the amount of air that the person is breathing into their lungs. So someone with sleep apnea, they partially wake up because they struggle to breathe because of that blockage of the airway. There are two different types of sleep apnea. The one more common is obstructive sleep apnea, and that is that relaxation of the soft tissue that blocks the passage of air. Another is central sleep apnea, and that occurs because there are irregularities in the brain's normal signal to breathe. So sleep apnea, it lowers the quality of a person's sleep because the supply of oxygen getting to the brain and to the body tissues has been affected. And when you have that lack of oxygen, it can really cause some potential serious health complications. And sleep apnea can affect children. It can be more common in men and can be more common in overweight individuals. Next slide. So symptoms of sleep apnea can include snoring. Often you can hear snoring in another room, so it can be pretty loud at times. But an individual may snore, and then you hear silence for a period of time. And then as the individual, they receive signals from the brain indicating you need to kind of wake up and start to breathe again. Then they start to gasp, or they make kind of a chorting or choking type sounds. Because of this ineffective breathing at night, it causes restless sleep. Often people wake up with a morning headache. Some of these individuals breathe through their mouth as a result of this, and they may have a dry mouth in the morning also. And of course, it causes just really excessive daytime sleepiness because they don't get that quality sleep at night. And because of the sleepiness or the decrease in oxygen through the brain, they can have trouble concentrating, they become more irritable, forgetful. It can contribute more to anxiety and depression, and of course, mood and behavior changes. Next slide. So one of the gold standards to diagnose sleep apnea is with a sleep study. And typically sleep studies are overnight in a sleep lab. And we're looking to see, does a person have sleep apnea, and also the severity. So there's three different levels of severity for sleep apnea. Person can have mild sleep apnea, moderate sleep apnea, or severe sleep apnea. Depending on the severity, it also helps to direct the treatment. We always look at lifestyle changes. So if someone is drinking heavily or on medications that could relax their muscles a little bit more, that can contribute more to sleep apnea. Losing weight, if someone is obese, it can be very helpful. We know smoking increases sleep apnea risk, so quitting smoking is very helpful or beneficial. If you think about someone just laying on their back, that can compress the airway a little bit, but having them lie on their their side, opens the airway up a little bit, which can improve sleep apnea symptoms. Sometimes certain pillows, just to position the neck in certain ways to keep that airway open, are helpful. Sometimes surgery is indicated. So the most common thing I see with children who have sleep apnea is big tonsils or adenoids. And you think about children, they have a narrow airway to begin with, but if their tonsils or adenoids are enlarged to a degree, it really can obstruct things. So removing them, having a tonsillectomy and adenoidectomy can be curative for those children. And sometimes too, just the anatomy too can impact. So again, I see children who have like low tone, floppy airway. Sometimes they need surgery to help fix some of those things, and that would improve the sleep apnea. Sometimes people need CPAP, which is a machine. It's called continuous positive airway pressure. And that you've probably seen or heard about that, but that typically is a device where someone wears a mask either over their nose or their nose and mouth, and it's providing air to keep those airways open to minimize that sleep apnea. And that can be very helpful for people who have moderate to severe apnea. Next slide. So another syndrome we typically see is restless leg syndrome. So the restless leg syndrome, individuals often have an unpleasant or an uncomfortable sensation in their legs. It may feel itchy, crawling, it can be a pulling sensation, achy sensation, can feel throbbing, or it feels like a pins and needles sensation. Individuals have this irresistible urge to just move their legs. Usually these symptoms start in the late afternoon or evening hours, and it becomes more severe at night when they're more likely to be at rest. Moving the legs or getting up and walking around often relieves the discomfort, but then the discomfort comes back as they go back to rest again. So because of this discomfort and inability to feel comfortable, it causes difficulty falling asleep, or if they wake up and the sensations are there, they have a hard time going back to sleep. So of course, this results in insufficient sleep over time, which also results in daytime sleepiness. Next slide. So RLS affects about 7 or 8% of the population. Women seem to be affected more than men. And this can begin at any age. Middle age, though, and older are more severely affected, however. And we do see this run in families, so it can have some genetic tendencies too. Next slide. So restless-leg syndrome causes can be because of an iron deficiency. So typically I would check one of the iron stores called a ferritin level. And if it's low, that could be a reason why someone has their RLS. Certain medications can contribute to restless-leg symptoms. We know that certain substances like alcohol, nicotine, and caffeine contributes to this also. RLS seems to be more common in pregnant women also. Also seen in individuals who have neuropathy or an end-stage renal disease, or they are receiving hemodialysis. Next slide. So management of RLS involves just a multitude of different things. There really is no cure, but there is very effective treatments. So we recommend that individuals avoid caffeine, alcohol, tobacco, any of those kind of stimulating products. Again, if their iron stores are low, you supplement with a daily iron for a period of time. Usually if you get your iron stores up, then symptoms go away and there's no need to continue those iron supplementations. Moderate physical activity has been found to be very helpful. Sometimes just massaging the extremities is helpful. Taking a warm bath, applying a heating pad. Some people prefer ice pack. So heating pad or ice pack, it's more up to the individual as to which one feels better. Keeping a consistent sleep schedule is important too, because we want to try to optimize someone's sleeping habits. Healthy diet is always important. If these above measures don't seem to work, there are some prescriptive medications that can be used to help with RLS. And there's even an FDA approved device that can be used also. And basically it looks kind of like a heating pad, but it sends off little stimulations to kind of counteract the symptoms that the RLS is putting out there. Next slide. So parasomnia is another type of sleep disorder. This is an abnormal sleep-related behavior. Parasomnias can be seen in both children and adults. Parasomnias can occur because of insufficient sleep, can be triggered by alcohol or other medications, and even other sleep disorders can contribute to this, like sleep apnea and restless-leg syndrome. Usually these occur anytime during the night. Someone can have one as they're falling asleep. It can be anytime during the night while they're sleeping or upon awakening. And with most parasomnias, the person remains asleep. They don't have any memory of what happened. And with parasomnias, as I mentioned earlier, we go through 4 different sleep stages. With a parasomnia, an individual seems to get stuck in that transition from one sleep state to another. Next slide. So one of the parasomnias that we see quite frequently is night terrors. So this is considered more of an arousal disorder, but it does occur during the nighttime, usually the first third of the night. Person will suddenly begin screaming. They are crying. They may be kicking their legs. Their arms may be flailing about. Their eyes are open, but they're not responsive. They can't answer questions. They can't follow commands. They appear terrified and frightened, very inconsolable. We do know that with night terrors, I see night terrors are pretty common in childhood. Usually they don't happen in older adults. But as a parent, when you see your child in a episode like this, you want to console them. But actually consoling them makes the episode last longer, and it makes actually it worse. So usually with night terrors, I have my parents just make sure the child is safe and just let the event run its course, because they only last a couple minutes. And the child does not remember these the following day. Like I said, it's really common in childhood, very rare in adulthood, and they usually go away after a couple years. So there's really no need to do ongoing intervention with this. Next slide. Nightmares is another parasomnia, and it is just an unpleasant, frightening dream that disrupts or awakens somebody from their sleep. If it's frightening or a scary enough dream, of course, it's going to cause emotional distress. The individual can remember the details the following day. Usually nightmares begin in childhood, and these do tend to continue on into adulthood. Next slide. So some other parasomnias include sleepwalking. And just like the name sounds, it's just someone who walks around while they're sleeping. So typically, someone has no recollection that they've been up walking around. People have been known to do things while they're sleepwalking. The one thing, sleepwalking is not harmful, but the one thing to be aware of is that it depends on the actions of somebody. Some people have been known to walk out of their house, like in the middle of winter, or walk out without a coat on. So there's a little bit of a safety aspect to sleepwalking that people need to be aware of. Most of the time, people just they wake up, they may, like a child may walk to their parents' bedroom, walk back to their own room. But for some individuals, the sleepwalking is a little more involved. So it's just a matter of making everyone aware of what the person is doing and keeping their environment safe. A confusional arousal is similar to a night terror, but it's just not as extreme. But usually it occurs in just smaller children. They will again wake up and they're confused and disoriented, but they don't have that terrified look on their face. They're not crying or screaming out. They again don't recall the event the following day. And these are pretty short and they don't last very long. Disorders of arousal is just kind of an awakening, still not awake, but maybe you see someone sitting up and then lying back down. Vocalizations or sleep talking also occur, or just even sudden body movements occurring during sleep. Next slide. So circadian rhythm disorders. This is basically your sleep and wake cycle. It's driven by an internal clock that regulates when you fall asleep or when you're tired or when you're awake. So we all have melatonin. It is a hormone that's produced in our body. Melatonin rises in the evening as it gets darker, and it's the highest during the nighttime. And so that influences how our sleepiness level is. The production slows down in the morning when it's beginning light, the sun is rising, and it also increases our alertness during the day. So with someone who has a circadian rhythm disorder, that ability to fall asleep, or the melatonin is a little delayed in their production, so they don't feel sleepy or fall asleep at kind of our society hours, or conducive hours to society here. This can impact a person's ability to awaken at times that are required to go to work or go to school or participate in social functions. With a circadian rhythm disorder, however, if an individual is allowed to fall asleep when they're tired and wake up when they feel rested, they're actually getting enough sleep that their body needs. They're just not sleeping at hours that that fit into like the rest of their family life, or like I mentioned, work or school hours. So if they have to wake up before they're ready, it creates insomnia, daytime sleepiness, the hard time waking up, and leading to sleep deprivation. Next slide. So there's a couple different types of circadian rhythm disorders. First one is delayed sleep phase. So that's a difficulty falling asleep until late in the night. So often people may not fall asleep until 1 a.m. or later, 3 in the morning potentially. If they're allowed to sleep until they wake up, they could sleep until noon or early afternoon hours. An advanced sleep phase is falling asleep too early. So some people may fall asleep at 6 p.m., but maybe or 7 p.m. But then they wake up at 3 a.m. and they're up for the rest of the day. Jet lag is considered a circadian rhythm disorder, and it usually occurs when you're traveling by air and you're crossing 2 or more time zones. And so your day and nights are typically mixed up here. Shift work disorders usually occur with night shift workers because they are up all night, and that is when our body wants to sleep. So they have a hard time sleeping during the day because our body wants to be awake. Next slide. So causes of a circadian rhythm disorder, as I already mentioned, is different shifts, night shift workers, also those who shift from a day schedule to a night schedule. Those not keeping a consistent sleep or wake times, for example, teenagers, again, they like to stay up late. They like to stay up even later on the weekends and like to sleep in too. So if that continues over time, it can contribute to a circadian rhythm disorder. Also, people who don't expose themselves to like the sunlight in the morning, or they have bright lights around them at nighttime too, can start to develop some issues with their circadian rhythm. Just poor sleep habits, lack of a bedtime routine, too many electronics at night. I've seen a lot more circadian rhythm disorders in the last several months because kids are not really in school. They don't have a routine. They don't have a schedule. So they go to sleep when they're tired and they sleep until they just wake up. So that's one of the things I'm seeing contributing to some of these the circadian rhythm issues lately. Jet lag, as I already mentioned, and sometimes certain medications can cause issues with sleep. We know some medications can be more alerting, so taking a medication at night may keep you up later than desired. Next slide. So treatment for circadian rhythm disorder involves getting exposure to daylight, waking up in the morning and going out getting out in the sun. Or there's some like sun lights or lamps that can be used also. Minimizing naps or limiting naps in the daytime. Naps do have a place, but if someone is taking too long of a nap, it can impact the ability to fall asleep at nighttime too. Exercise is good because it helps you sleep better, establishing good sleep habits. And sometimes we have to shift our sleep wake cycle. So, what I mean by that is, for example, those individuals who are staying up too late and sleeping until afternoon, it may involve waking them up 30 minutes earlier every couple days. And the hope is that they will back up the time that they fall asleep by 30 minutes or so. So we shift their times that they actually fall asleep and wake up to more reasonable hours. Next slide. So periodic limb movement disorder is just involuntary movements of the extremities or limbs during sleep. These can be small movements such as a twitch of an arm or extremity, or even wild flailing of all extremities. If it's just small twitches, it doesn't typically cause too many problems, but if it's more excessive, it can disrupt the sleep. People may have trouble falling asleep or staying asleep, which then contributes to daytime sleepiness. Next slide. So narcolepsy is another sleep disorder, but it's also a neurologic disorder too. This is the decreased ability to control your sleep-wake cycle. It can affect 1 in 2,000 people. One of the hallmark signs of this is excessive daytime sleepiness. They also have sudden sleep attacks. So they may just suddenly fall asleep. They have this need or urge to sleep. It's not willingly, so they will unwillingly fall asleep. And it can be while they're eating, during work, school hours, or even while driving. You can also have what's called cataplexy, and that is when you have a sudden muscle weakness with an intense emotion like laughing or being fearful or scared. It can be as extreme as actually falling to the ground. It may just be more subtle, such as like a little head bop, or like the neck muscles seem to become weak, or like you feel like you're going to buckle at the knees. You can have vivid dreamlike hallucinations while falling asleep or when awakening. That can be like someone may say that they saw like a shadow of a figure in their room. You can have sleep paralysis. Usually on awakening, you feel like you cannot move your body at all. Also just waking up frequently at night too. And next slide. So again, narcolepsy causes sleep fragmentation, difficulty sleeping at night. It can affect males and females equally. Because of the excessive daytime sleepiness, this can limit the ability for someone to attend social gatherings, or if they have these sleep attacks, they may not want to attend social gatherings because they're afraid that they're going to suddenly fall asleep. And of course, if you fall asleep in school or at work, it's going to impact your abilities there. Narcolepsy typically begins in teenage years, but it's hard to diagnose. So often it's misdiagnosed, which can delay treatment, however. This is a condition that is chronic, so usually someone will have this through their lifetime, but it can be manageable. There are medications that people do use to help improve the alertness during the daytime, and also help some of the other symptoms. The way to diagnose narcolepsy is with a polysomnogram or sleep study, followed by what's called a multiple sleep latency test. And those are done in a sleep lab, and usually with your MSLT, it is a test during the daytime where you're given opportunities to fall asleep or take short naps. And if you meet certain criteria, you often have that diagnosis of narcolepsy. Next slide. So treatment for narcolepsy, I mentioned medication is available to help. Keeping a regular sleep schedule. Some people just may need more sleep at nighttime. Avoiding stimulants like caffeine, alcohol, smoking, daily exercise. Sometimes short naps may be necessary, just even 20 minutes at a time in the afternoon, just so it can help them get through the day and help them function better. I have to say with naps for adults, anything longer than 20 minutes or so is not quite as restorative. 20 minutes or less is more restorative for adults. And also too with narcolepsy, we want to take safety in mind too. So we want to make sure that whatever the activity someone is doing, whether it be driving, the work environment, that, if they would have a sleep attack, for example, they are in a safe environment and they're not going to harm themselves or anybody else. Next slide. So I was going to touch a little on seizures. Next slide. So as you know, seizures occur due to neuronal excitability, leading to abnormal brain activity. We're not exactly clear on the mechanisms of it, but we know that poor sleep can trigger seizures in those individuals who are predisposed to having seizures. And of course, we know seizures can contribute to sleep issues. So if someone is having frequent daytime seizures, it can cause sleepiness, more sleepiness or tiredness during the day. And then if you have seizures at night, it's going to disrupt your quality of sleep there. We do know that more seizures occur as a person is falling asleep and waking up, because as you're transitioning into sleep, if there's abnormal brain activity, they tend to come out more in those times. We do know that seizures can occur anytime during the night, however. Next slide. Just was going to mention a few types of night seizures, and this is not all inclusive. There is one called benign epilepsy with central temporal spikes, or BECS. It's one of the most common epilepsies we see in children, and this involves a seizure that occurs after they have fallen asleep. Typically, they may wake up and they feel a twitching of their face, inability to speak. Usually they don't have seizures during the daytime, only at night. And this is a seizure disorder that they typically will outgrow. There's seizures during non-REM sleep called nocturnal frontal lobe epilepsy. And then there's another seizure type called continuous spike wave in sleep, where someone will have a lot of abnormal brain activity while they're sleeping. Next slide. So I just want to note that not all spells are sleep-related and not all spells are seizure-related. Something that may look like a seizure may not be a seizure, but it could be a sleep disorder and vice versa. So some sleep disorders may actually be a seizure. So it's really important to get a good description of what is being seen, and then we know what type of diagnostic test to do next, because we want to make sure we are classifying whatever is going on correctly so we can apply the appropriate treatments. Next slide. So just some things to keep in mind. It's really important to look at medication and their side effects. We know with our seizure medications that many contribute to drowsiness or just being tired. So if someone is taking medication during the day and you're tired after taking the medication, that should be addressed with your primary provider, because we want people to be functioning optimally during the day and not be sleepy, especially during school or at work. What I have done is, if I know a medication causes more sleepiness during the daytime, I may prescribe a higher dose at night when I want them to sleep, and maybe less in the morning so they're not quite so sleepy, or space them out throughout the day. Some medications actually have the opposite effect and are more alerting. So instead of making someone fall asleep, they're actually more hyper, they're more wired. And of course, if that's taken in the evening, close to bedtime, it's going to impact the ability to fall asleep. If you have any concerns regarding your sleep, like you feel like you have insomnia or you have suspected sleep apnea, that's important to discuss with your provider, because those should be evaluated further, and so the appropriate care and management can be implemented. If there's concerns that there are seizures versus sleep disorders, important to talk about that. just so we can clarify that and know what treatment's appropriate. And as I mentioned before, stress and anxiety can impact your quality sleep, so addressing those is very important. And then just sleep hygiene or sleep habits is very important. So, and this is good for anybody. It's important to have that consistent sleep schedule. Establish a nighttime routine. Expose yourself to natural light in daytime hours. Incorporate physical activity, and just limiting alcohol, tobacco, or caffeine in those type of products. Next slide. So I do need to talk about SUDEP. It's not a pleasant subject, but it is something that is out there to be aware of. SUDEP is sudden unexplained death in epilepsy. It does affect 1 in 1,000 people. Research is ongoing, and we don't really truly understand what causes SUDEP, but we do feel it has to do with an irregular heart rhythm or breathing difficulties because of a seizure. We do know that people who are more at risk of having SUDEP are those individuals who have tonic-clonic seizures, seizures occurring during nighttime hours, poorly controlled seizures. So it's really important for us as providers to make sure we are optimizing treatment and trying to get someone seizure-free. We do know those individuals who are non-compliant with their medication and are not taking them as appropriately prescribed are at higher risk also. Next slide. So again, with SUDEP, we cannot predict who is going to actually experience like a SUDEP-related event. We just know those people who had higher risk factors. So as a result, we just want to do what we can to optimize someone's seizure control. Again, making sure that they're on the appropriate medications at appropriate doses, just recognizing some seizure triggers and avoiding those if possible. Some of the most common seizure triggers can be sleep deprivation and illness. And like with sleep deprivation, we know being it's a seizure trigger, we want to maintain or obtain quality sleep. Really stress the importance of being compliant with taking seizure medications as prescribed. Avoiding alcohol or drugs because those can interact with your seizure medications, causing them to be less effective. And just keeping yourself really healthy, eating well, exercising, just supporting that immune system and minimizing illness. Next slide. The question always comes up is, am I getting enough sleep? So some things to be aware of that may clue you in as to whether you're getting enough sleep or not is just hard time concentrating, difficulty with remembering things. People look tired, puffy eyes, there's bags or dark circles under the eyes. Being sleep deprived makes you feel hungry. As a result, you may eat more, gain weight, just more irritable or moodiness or cranky overall. Some people experience more depression. People tend to become sick more frequently or have a hard time recovering from illnesses, or it takes them longer to recover from illness. And just more accidents in the workplace or a motor vehicle. Next slide. So getting good sleep is important for our overall health, but everyone is different in the amount that they need. So these are just some guidelines that for just different age groups. We do know that newborns need anywhere from 14 to 17 hours in a 24-hour period of time. Toddlers from 1 to 2 years of age, anywhere from 11 to 14 hours. Individuals from 3 to 5 years of age, from 10 to 13 hours. School-age children from 6 to 13 years need about 9 to 11 hours. Teenagers, about 8 to 10 hours. The adults from 18 to 64 years of age, between 7 and 9 hours of sleep, and adults over 65 years need between 7 to 8 hours. And of course, these are just guidelines, and everyone's a little bit different. So some people may be fine on that lower end, others may need on that upper end, or maybe even more too. Next slide. So teenagers tend to, we do know that children tend to go to sleep early, need more sleep, but as teenagers, as you move into the teenager adolescent years, we know the sleep habits change. So 2 out of every 3 teenagers don't get adequate sleep. We do know that their secretion of melatonin tends to delay. The excretion is delayed in adolescent years. So they don't feel sleepy like as an adult would or a child would. So they feel sleepy later in the evening. And so they fall asleep later, and the natural tendency is to sleep more in the morning. Sometimes, though, their poor sleep habits contribute to sleeping or falling asleep later because they like to be on their electronics, they like to be on their phone. Um, but some other things that affect their ability to fall asleep at reasonable hours can be because they are in extracurricular activities and they may not get home until later in the evening, and often they have homework to finish. And so then that delays their bedtime. Um, we know that they have to wake up earlier because school tends to start early for teenagers too. So if you fall asleep later and you're getting up earlier, you are not getting the amount of sleep that you need. Next slide. So with our sleep habits, some things just to keep in mind is that we want to keep a consistent sleep schedule. Go to bed and wake up at the same time. Typically, even on weekends too. And I know that's hard because people like to sleep in on weekends, but keeping that consistent schedule is better for your overall health. Establishing a bedtime routine, like playing some calming music, reading a book, taking a bath, just things that are more calming and not stimulating to just to help your mind unwind and relax. It's been shown that sleeping in a cooler bedroom helps to promote sleep. Not having too many covers on also is important because you don't want to overheat because you won't restful sleep if that's the situation. Having the bedroom quiet is very helpful. It's been recommended that no electronics before bedtime, like 30 to 60 minutes before going to sleep, helps your brain kind of calm or unwind. The blue light from those electronics tends to stimulate the brain, keeping you from falling asleep easily. Keep the room dark is important. Being comfortable when you sleep too. So having a comfortable mattress and pillow is important because you're not going to sleep well if you're hurting somewhere or you have aches and pains. Important to eat 2 to 3 hours. That should say hours in there. I apologize. Eat 2 to 3 hours before your bedtime because having your stomach too full or too big of a meal impacts your ability to fall asleep. Exercising regularly helps to get quality sleep. Limit your caffeine products because some people can be very sensitive, and even something in the afternoon can impact the ability to fall asleep easily. And we know that alcohol, even though some people feel that they can sleep easier on alcohol or after they've had a drink or two, it actually does not give you quality sleep. Same thing with nicotine. Avoid those close to bedtime. Next slide. So quantity of sleep is important. So the number of hours you get is important, but the quality is too. So we know with nutrition, our digestive system slows down as you sleep. So eating too close to bedtime can impact the ability for you to get quality sleep. Having a large meal, a fatty meal, also the digestion is not working as it should, so that's going to impact your ability to fall asleep. Spicy foods also can contribute to things like gastroesophageal reflux, which can keep you up at night. We do know that foods high in vitamin B, with the B vitamins, helps to regulate and produce that melatonin. So some of those foods include fish, poultry, legumes, eggs, dairy products. There's always a question of sleep trackers. So a sleep tracker can help detect just overall patterns of how you're sleeping. Kind of tracks when you are falling asleep, how often you're awake during the nighttime. There are, of course, we all know there's the Fitbits, you have, Apple Watches. Those are great over-the-counter, just products you can buy. There's also like a medical grade Fitbit type thing called an integraphy. With the integraphy that also detects light, so it can so it knows like when, if you're awake during daylight hours versus nighttime hours. Sleep trackers, I would use them with caution because they are not, there's always a little degree of error though, but they are still good because they can help show patterns. So they can give you an estimated time of when you're falling asleep, how much you may be awake at night, and kind of help shape some of the sleep habits if anything needs to change. But one word of caution though is some people become too anxious using a sleep tracker, which then can impact the quality of sleep too. I always like to ask, how do you feel when you wake up? If someone is sleeping and they wake up on their own and they feel refreshed, they're probably getting enough sleep. But if someone needs like their spouse or an alarm clock to ring 5 times, or teenagers need their parents to get them up, or come into the room 3, 4 times, they're probably not getting enough sleep because they are having a hard time waking up on their own. Next slide. So in summary, sleep is very vital for our overall mental and physical health. So it's really a basic human need, just like eating and drinking is. It is a necessity. And sleep is so important during childhood because it has a vital role in children's growth, in their memory, and in their learning capacities. And sleep disorders are common in people with epilepsy, but it doesn't mean that, with good sleep, it really impacts somebody's epilepsy control. But if you do have any sleep concerns, please discuss them with your provider. And if indicated, then you can have a referral to like a sleep clinic where you can have more in-depth testing if indicated. Next slide. And those are just some resources to go to too if you have more questions or want to read more about any type of sleep disorder. Next slide. I think that's all my slides. So I think we'll open it up to questions.
Great. Thank you so much, Denise, for that wonderful amount of information. I just want to remind everyone that you can open up that Q&A and put any question that you might have. We do have a few questions that have come in. We'll go ahead and get those answered first. There was one question that is really just about, that I'll cover at the very end, about getting the recording of this webinar. It's great to see that people are wanting to share this with family and support systems. And so yes, there will be that opportunity that I'll explain at the end. A couple of other questions that have come in. One is, can you remind us, what does PSG and MSLT stand for? What those two are?
Oh, certainly. PSG is polysomnogram, which is just a real fancy word for a sleep study. And MSLT is multiple sleep latency test. And that is the test that we would use if we suspect somebody has narcolepsy.
Okay, great. Great question. And then a question is, what is a spell? I think you referred to a spell on one of your one of your slides. Yep.
Yeah, I use spells a lot, and that just means like an event. So
Yep.
if I work with epilepsy too quite a bit, so I always talk about spells. And really what I mean by spell is the activity or the behavior that somebody is observing.
Awesome. Great. How common are seizures during sleep?
I don't have a percentage, but they do occur. And I think it depends on a lot of factors. One, I think it depends on what type of seizure somebody has. It's going to depend on just how well controlled your seizures are. We do know that there are some seizure disorders that occur more at night. So it just it's a hard question to answer because it depends on a lot of other factors, but
Right.
It can happen. I'm not going to say it's not rare, but I wouldn't say it's like super, super common.
Okay. Yeah. Great. I think it's one of those, it's an individual diagnosis, right? So it really depends on the individual. Great question here. If you don't get enough sleep for a night or two, is it best to try to catch up on the sleep you missed or just move back into a regular schedule?
It probably depends on like how much you're missing. So we all do that. Life happens. We're going to go to bed a little late. You try to get on your schedule as best as you can. And if you have an opportunity to grab a few extra minutes of sleep here and there, I think that's very beneficial. A couple nights of your altered sleep schedule is not going to contribute to a lot of the chronic health problems I talked about. It's going to be like sleep deprivation over prolonged periods of time. And I think if you're just missing a couple nights here and there, your body's going to catch up too. So it'll, 10 minutes here, 10 minutes there. So, or maybe an extra half hour in the weekend.
Yep. Great. One question we have is, I work a shift schedule. I work 3 weeks of days and then 3 weeks of nights. Do you suggest that are there good ways that I can transition from a day to a night schedule? That's a tough question.
That is hard, yes. I did day and night too for a long time when I was a registered nurse, and they are hard shifts. Um, it's, I found, I think it's harder. I think it's fortunate you have a stretch where you're doing days for a couple weeks and then you switch to nights. It's harder if you have only a day or two to make that switch. I would just maybe recommend gradually transitioning to staying when you're moving into the night shift, staying up a little bit later and trying to sleep in a little bit. One of the, and then trying to get quality sleep during the daytime too, when you're actually staying up through the night. Because that is one of the hardest things is because your body wants to stay awake during the daytime hours. And that's when you need to sleep. So you're up, so you're able to stay up for the night. So, maybe introducing some melatonin in the morning, making sure your room is dark so you don't have exposure to sunlight, and trying to sleep for a couple hours. Sometimes it's helpful to maybe break it up, like, a good couple hours in the morning, but then maybe another couple hours later in the, like, before you actually go to work can help improve the sleep there. But, it is hard to do that switching back and forth, but
Yes.
just I think environment is key too. The dark room, quiet. Try to introduce some melatonin in the morning, like I mentioned, and just try altering your, the times that you are staying up a little bit later and trying to sleep in if possible.
Great. So, a couple of questions that look a little bit similar. Are there any monitors available that monitor seizure activity during sleep?
There are some monitors. If you go like to the Epilepsy Foundation, I know they do have some there. The caution I'll throw out there with those monitors is they can give you a lot of false readings. It's probably depending on someone's seizure type or like the age of somebody. For example, with my work with kids, they move around a lot at night. So if you have a sleep tracker, or excuse me, a seizure tracker, it could just be going off quite frequently because the child is moving around a lot, and they're not having a seizure. I have parents that don't sleep well because the monitors are always going off. So I would just use them with caution too. But there are some out there. Yeah.
I would also say that if you're looking for what is available and out there, we do have resources at the Epilepsy Foundation, and I'll make sure to include some of those in our follow-up email. You can also go, I know that Danny Did Foundation is a great website to go to look at what's out there. They also will help provide, in some cases, some financial assistance if needed in getting those types of monitors or devices. So,
I will say too, like, I think one thing that can be helpful is just like a baby monitor. So you can hear what's going on, or like a video camera type thing, so you can see what's going on there too.
Absolutely. This is somewhat related. How would you know if you're having seizures in your sleep? I have partial and they cluster.
Okay. Unless there's someone making noise, it can be really hard, because if it's silent, the other individuals in the house may not know. I always clue people to how are you the next day? If someone is having a harder time waking up in the morning, sometimes if you like bit your tongue or cheek, is there blood on the pillow, or drooling? Or they just seem a little more off the next day. Those can be some subtle clues that something could be going on during the night that may not have been observed.
Right. Exactly. Do you have any sleep apps that you would recommend? And another question was, do you have any relaxation apps that you would recommend? Or do you recommend them at all?
Yeah, I think everyone's different. Some people love them, some people can't do it. So you find the one that works for you, but there's a lot of great apps out there. The one I have used on occasion is Calm, CALM. That's a great app, and you can get it on your smartphone, and you can just choose different types of, it's like a meditation, some are meditation, and some just play like, nature sounds. And they can be different lengths. So, I think that's a great one I've used quite frequently.
Great. Yeah, but that's the one that I am aware of. There are several of them out there, and just
Yeah.
I always say if you're searching for one, just look at some of the reviews, because it'll
Mhm.
tell you whether people really find them to be useful or not.
Yeah.
As we tend to have an overload of choices oftentimes. So,
Yeah.
question here about, is it okay to give preemptive melatonin for anticipatory anxiety-induced sleep disorder?
Yeah.
And
Melatonin is really not harmful. I mean,
okay.
on the only side effect I have seen with like supplemental melatonin is potentially some nightmares, so or vivid
Yeah.
dreams. So just be cautious of that. But I mean, our body makes melatonin. It's not something you can become addicted to. So I would just generally recommend maybe a small dose, usually 30 minutes before you go to sleep. And you certainly can try it. If it doesn't work, it doesn't work. But and melatonin, when you take melatonin, it doesn't last very long. So it's out of your system within a couple hours. But I don't think there's any harm in trying it.
Great. I'm just going to remind everybody, if there's any last minute questions here as we finish up our question period, please feel free to put those into the question Q&A. Just kind of a comment from one of our attendees that another great app is Insight Timer. I have not heard of that one. So check that one out as well. One more question that's coming in. A couple of them. What do you know about neural therapy and benefits for relaxation and stress reduction? Neural therapy, I have not heard that term before.
I'm not familiar with neurotherapy.
Okay, nope, that's okay.
But
we'll have to do a little research on that and see what we can find. Yeah. Can you take melatonin and your medication at the same time? I'm assuming we're talking about a sleep medication or one that has maybe a drowsy side effect.
Okay. Yeah, usually I have many patients that will take their melatonin and they're on a different sleep aid also. So those should be just fine together. My recommendations with any sleep aid is to take it about 30 minutes before you want to fall asleep. Because if you take things too soon in the evening, the effects of the melatonin could wear off, or you're going to be too sleepy earlier in the day or in the night, and you may not fall asleep when you really want to fall asleep.
Right. Great. Any last minute questions? I'm going to give you kind of the 30 seconds to type anything else in if there's any other questions that we have. These are great questions and just a really great feedback and interaction here. We also have another someone who recommends M-O-S-H-I, Moshi or Moshi. I'm going to say it wrong. It's a sleep app for kids. So check that one out as well. And we will, I'm writing these down so that I can check them out. And then if people are interested in getting them in the follow-up email, I can also include there. One last question. Is there any danger of interactions with melatonin and seizure medications?
There really is not.
Okay.
Yeah. No, melatonin's pretty safe.
Okay. All right. What are some recommended caffeine reducers? Not quite sure. Ways to reduce your caffeine. Do you have any recommendations if you're really a caffeine person?
Oh, yeah. Yes.
Used to be one, but I've reduced.
Yes. Yeah. That it is hard to wean off caffeine. Yes. So, won't say I'm an expert by this at any means, but sometimes just maybe let's say your afternoon, if it's a coffee, for example, like half and half, half non-caffeinated, half caffeine, and then just keep cutting it back every day for a period of time. I'm definitely a morning coffee person, so I don't know if I could get away with that, but definitely caffeine in the afternoon can impact your ability to fall asleep at night. But just starting to cut back a little bit, smaller quantities, and just reduce over time. If you do too much at once, it's going to cause more headaches and probably more problems with sleep, and you just don't feel good. You can become irritable. So slow reduction over time is usually the best.
Yep, great. And you did say 30 minutes is what you recommend taking the melatonin or that before sleep, 30 minutes before.
Yes.
So that was the other question. All right. Well, this is concluding our question and answer period. Thank you all so much. If you had a question that wasn't answered, you can feel free to reach out to us at the Epilepsy Foundation. I just want to move forward with a couple of other slides as we finish up what is already a very quick 75 minutes here together. couple of additional sleep resources that I happened to find as I was researching. There's some PDFs, if you will, some poster-like things about that healthy sleep duration. These both come from the Sleep Academy, or the Academy on Sleep Education, the American Sleep Academy, I believe is what it was. I think I had a typo in that last slide as well. But this one was kind of interesting to me because it talks about binging, as you mentioned, the electronics and our connection to our electronic devices like our phones. This one is a really good one, and you'll get this handout and be able to get to the link when you get the handout, just looking at what we are spending our time and how it impacts our sleep habits. We do have some additional resources I want to mention that if you have questions, if you joined us and you are new to the world of epilepsy or seizures, when you get your follow-up email, there will be some resources there for you to check out, including other programs and services that we offer, just some basic information on epilepsy, some recognition and response charts, and you will also receive in your follow-up email not only this webinar's handout, but some additional sleep resources that we found, including we have a really good one that has multiple languages with some basic sleep facts as well. So look for that to be coming. We also do have a link here for our upcoming EFMN events, as we have several different things happening coming up this spring. I just want to take this time to remind you who we are. We lead the fight to overcome challenges of living with epilepsy and accelerate therapies to stop seizures, find cures, and save lives. And so that's really what we're all about at the Epilepsy Foundation. And we really thank you for investing your time tonight, but also trusting us to be a partner with you in your epilepsy journey. We do have a really great information services department, and our information services are a little bit different than many out there, where we provide free one-on-one support for individuals or support systems, family members, anyone who's working with someone who has epilepsy or seizures. You can follow this link or go to our website and click on information services and really fill out a web form that just tells us what you're looking for as far as support. Are you looking for something related to your diagnosis, something related to your treatment, something that's impacting your, been impacted because of your epilepsy? We will work one-on-one with you to find customized tools and resources for you. And in some cases, referrals. Where can you go? Where's the best place that we can send you to get more information and more assistance in meeting the needs that you have. Just some reference slides here. I want to, before I talk a little bit more about the next wellness webinar, I want to take this moment to just really thank Denise again for joining us. This was a fantastic start to our 8-part series, and I was joking with her, I think earlier in the week, I think Sleep Awareness Week was last week. Hey, we didn't hit it, but you know, sleep is one of those topics that's so important and that we all can learn from, whether we have any other underlying health conditions or not. And so I really want to just take this time to thank you so much for your expertise and answering all of our questions. It's been great to have you here.
Yeah, my pleasure. Happy to be here.
Mm-hmm. I want to let everyone know, just as we wrap up, last slide here, is that our next wellness webinar, well, it's a mouthful. On our next Wednesday wellness webinar, or Wellness Wednesday webinar, however you want to get that triple W in there, is on diet and physical activity and epilepsy. That is on Wednesday, April 28th. And again, the time for these are all the same time, 6:15 to 7:30 p.m. And we will be joined by Nate Hendrickson, who is the Director of Special Needs Fitness for children and adults at TNT Fitness and Gymnastics in Fargo. Nate, I've known Nate for many, many years, and actually he has worked with my children, and he is a dynamic speaker with lots of information to share, just like you had tonight too, Denise. So I encourage everyone to consider registering for that event as well. And then just one final reminder of what you will receive, because I've kind of said it throughout. Within the next week, you will receive a follow-up email that will include the handout. It will include some additional resources about sleep and epilepsy. It will also ask you to give us some feedback, because that's always important for us to hear from you, what you know, if this was of value to you, and it's a very brief survey, but I also want to let you know, you'll also receive a link to our Wellness Wednesday webinar series webpage where the recordings will live. And so this recording will be, it may take just a week or so to get it up online because we have to do but our marketing team will be putting that together and getting it online, but you will be able to access that at any point. And that's a great piece of this 8-part series is every single one of them. If you have family or you're not able to jump in on one of them, they will be, the recordings will be available on our website. So with that, I want to thank you all for joining us again. Let you know that it's a pleasure to be able to provide this opportunity for all of you. And if you have any questions, please don't hesitate to reach out to us via our website at efmn.org. Thank you, everyone. Good night.